Can start.
Thank you. Good afternoon to all the delegates. I always believe this time of the lectures there's something called postprandial cerebral ischemia. Yeah? And knowing the attention span of us human beings, probably less than 10-15 seconds, so I think we'll be free to browse our WhatsApp and catch on. But what I endeavor to deliver is a very concise presentation on cannabinoids. I must ask one of the organizers why he gave me this topic to talk. Hope it's not related to my trips to Amsterdam last month. Right. I work as a pain consultant, working for the National Health Service in the United Kingdom, based at Medway Hospital in Kent. I trained here locally. I did my anesthetics from JJ Hospital. And then I moved on to UK in 1999. Nothing to declare and no conflict of interest. Few learning objectives from this presentation, which I like to talk about, otherwise I will deviate away from the topic. Historical perspective of this cannabinoids, the drug development, the scientific principle behind the development of this medication, pain management perspective, and safety concerns regarding this. Hopefully, at the end of this lecture, we all will be enlightened about cannabinoids. This is a new topic for me as well. The only time I've used cannabinoids was when I was a trainee. We used to prescribe some sprays and tablets. So if there's any shortcomings on this lecture, please bear with me. Cannabinoids has been recently in the media for the good and for the bad reasons. Till this paper came, the industry were of the opinion there's no deaths or any mortality related to cannabinoids. And this happened very recently, last month in fact. And America is fighting its own war on medical cannabis. And we have this opioid epidemic happening everywhere. And people are now questioning the prescription of neuropathic medications. So are we looking at a new alternative? That's what the media would like to know. And from my point of view, why is this topic so popular? Because of one thing was the wide coverage in the media. Medical cannabis has become a lightning rod for political commentaries, social commentary, and economic commentaries. And everybody seems to have a polarized opinions, especially among the medical community and on top of that, the pain management community. Because not only are we dealing with an opioid epidemic, we're also being increasingly scrutinized in terms of what we prescribe. So the only stumbling block I've seen so far is a paucity of evidence to make this more tenable. Historical perspective, this is the third most widely used drug globally. My friends will tell me what's the other two. Not paracetamol and fluoxetine, which we want to put in drinking water in few countries. You're right. And crude extracts from cannabis has been used for ages. If I study the literature, 3,000 years ago, they've been using it all over. China, etc. They were using everything from the dried roots to the stem to the leaves, etc. But there was lack of standardization at that time in terms of what's the shelf life, what's the storage, preparations, half-life. And this led to a global prohibition of cannabis. And there was a halt in development of this medication. Then cannabis entered the scientific arena. Two Israeli scientists identified tetrahydrocannabinol, which is the psychoactive compound of cannabis. And then there was the resurfacing of medical cannabis use. And there was lots of case histories with alleged positive results at that time. Further development of this drug was the synthesis of dronabinol and nabilon. And these were not used for analgesia. They were used as antiemetics and also for appetite stimulant. Following on, the first G protein coupled receptor, CB1 and CB2, were discovered, and then this triggered a search for these endogenous ligands called as endocannabinoids. Right, so the definition of cannabinoid. I want to make it very clear to the audience, we are not talking about cannabis per se. It's the extracts of cannabis we are talking about. So this is cannabinoids. Any chemical structure, any substance which acts on the biological receptors and produces action equivalent to that produced by the extracts of cannabis sativa is called as cannabinoids. There are three sources of cannabinoids: phytocannabinoids, which are extracted from plants; endocannabinoids are neurotransmitters produced by the human body; and synthetic cannabinoids, which are, of course, synthesized. Few words about phytocannabinoids. The primary active ingredient is THC. What they have researched now is there are almost 100 cannabinoids present in the plant cannabis, of which only 2 are available in large quantities. The rest are very minute. Now they're talking about genetically modified cannabis, where you can extract as much as possible exact chemical what you want from cannabinoids. This works at the CB1 receptors, and there's another one which they've got hold of, and that's called as cannabidiol, and it's a non-euphoriant compared to THC. Coming back to endocannabinoids, I did mention they're released in the human body. They act as neurotransmitters. They act on these CB1 and CB2 receptors, and they're not stored in vesicles. They're synthesized on demand, and they act on the GABA and the glutamagic receptors. And so far, no endocannabinoid has ever been administered to human beings because it is not stored in the human body. It's only produced on demand. Right, coming back now, talking about the endocannabinoid system, which comprises of the cannabinoid receptors, the ligands called as endocannabinoids, and the metabolizing enzymes. The endocannabinoid system is very tonically active in the control of pain in the human beings, and they regulate few things like appetite, pain, and sensation. There have been papers which prove that if there is an endocannabinoid deficiency, people will develop refractory pain, whether it is migraine or fibromyalgia or other painful conditions, and they have evidence to support that. Next, we're talking about CB1 receptor distribution. CB1 receptors are present both in the central and in the peripheral nervous system, controlling pain. One place they have not been identified is the respiratory center in the medulla. They don't have the CB1 receptors there. And these receptors have got both peripheral, spinal, and supraspinal mechanism of action. They act at the thalamus and at the cerebral cortex, modulating pain. And here is the mechanism of action. As I mentioned before, the endogenous cannabinoids are released at the postsynaptic neuron. There, and then they act on the receptors, and with a retrograde mechanism, it comes into the presynaptic neurons and stop the release of neurotransmitters. Look, they usually synthesized here, and therefore what happens is once these presynaptic vehicles are activated, they inhibit the release of neurotransmitters, and they're also metabolized at the same time. Cannabinoid preparations, these are the ones available worldwide. You have phytocannabinoids, these are the 3 available. We use this in a few countries in Europe, in UK and Canada, as a mucosal spray. We don't have access to this, and this is only used in Netherlands. The synthetic one is more popular, but it was mostly used for nausea and vomiting, for chemotherapy, and for appetite stimulant in AIDS, but it's now being used for spasticity in MS as well. Few words about the pharmacokinetics of these things. If you're using inhaled, in terms of absorption, rapid onset of action, 18% bioavailability, and inaccurate dosing. And orally, this is what we get. Very difficult to titrate and poor absorption. So what are the risk factors with cannabinoids or contraindications? Family history or personal history of psychosis, unstable ischemic heart disease, pregnancy, breastfeeding, liver, kidney disease, and in the elderly. And there are a few side effects or adverse health effects as they describe is. One is the cannabinoid dependency syndrome, chronic bronchitis and impaired respiratory function. There's almost reports of psychotic symptoms and disorders along with cognitive impairment. Very few countries have attempted to legalize this in spite of movement by people wanting to have this. I think it's USA, Denmark, Canada, and few countries in Europe as well as Israel, where they've used this for medication reasons. I tried to gather some evidence in terms of the medical cannabinoids. So we got one paper from Martin et al., where they used cannabis preparations to placebo among subjects with chronic pain. The only problem with that was the patient group was of questionable quality, and this was the evidence, according to them, was it's efficacious for treatment of pain, but they might be offset by serious harms, and we needed more studies on that. The other one, what I could get was this by Lynch et al., and this was for non-cancer pain, 15 to 18 trials, but he used a wide range of indications. And what we got to hear was the significant analgesic effect of cannabinoids as compared with placebo, and side effects well tolerated. And this was a very good report by Farrell and Hall, where they did a commentary on all the available evidence. And he goes one by one based on the evidence, what he talks about, especially with in multiple sclerosis. The long-term safety of this has not been established, but it's been used for spasticity in multiple sclerosis. And the other one he talks about is other painful conditions like traumatic neuropathy, HIV, and diabetic neuropathy, where the conclusion is not been proved. Then he also talks about other conditions like fibromyalgia, where any benefit is likely to be very modest. Long-term safety has not been established in this as yet. And in cancer pain, the benefit is likely to be modest, but it's got its own risk, including alteration in perceptions and cognitive functions. And conclusions was, from my point of view, the study of cannabinoids is still in a very early days. There's lots of clinical studies available, but what we need is long-term RCTs to get definitive evidence of this, because our patients deserve no less. Thank you.
Thank you, Dr. Reddy. This was a nice topic, very basic topic, nicely covered.
It was very
I think we'll take the question answers at the end of the session.